Welcome, viewer, to our Capstone video. Our group has been collaborating with Capgemini to develop a new healthcare system. Our team believes that the biggest bottleneck in today's healthcare system is not the providers, but the software they are forced to use. We have built a solution for this problem. Picture this. It's a hectic morning in the clinic. Mr. Umar walks in with a sudden case of chest pain and shortness of breath, showing symptoms of an irregular heart rhythm. He's panicking and needs attention as soon as possible. However, the only nurse available has 10 minutes to see him and 340 pages of patient history to sift through, spanning 8 software systems. And here lies the problem. Healthcare workers are required to consume massive amounts of data from several sources and condense the product of their tools into a single message for their patient. This complicates their workflow, slows the development of urgent treatment plans, and takes the focus away from the patient. We have built a healthcare dashboard that solves this issue, blending interpretable machine learning models with generative AI to distill patient information into a more digestible format for the benefit of the provider and the patient. Mr. Umar's nurse opened Starflower. A generative AI summary condenses the history into a paragraph she can skim in 20 seconds. A transparent machine learning model produces a heart disease risk score alongside it, with a descriptive graph explaining the score she can actually understand. When she starts developing a treatment plan, a chatbot provides starting suggestions based on Mr. Umar's data. 10 minutes becomes 5. The other 5 minutes go back to the patient. That's the ultimate outcome of our product. Data-driven assistance the clinician can trust, so their attention can be where it belongs, onto the patient. For our project scope, we were tasked by Capgemini with building an application that integrates generative AI and chatbot support with 3 predictive machine learning models. These include heart disease risk, hospital readmission probability, and drug dosage optimization. Our solution is a web-based dashboard. Here we can see a diagram that represents our architecture. User interactions are recorded on our front end, which are sent to our Node.js middleware. From here, requests are sent to the backend for our app's functions, including data handling, chatbot requests, and model predictions. The responses are then returned to the front end as patient summaries and visualizations. All of these tools are containerized within Docker to streamline our development environment. Now we're going to transition into our product demo, starting with our login page. Our application will be integrated into closed healthcare systems, ensuring HIPAA-compliant security of patient data. Administrators would also provide login credentials, just so no unauthorized users are able to access that data. Now I'm going to log in, which brings us to our landing page. On login, users are able to clearly view the tools available to them. At the top of the screen, users can see the primary models mentioned prior, as well as some additional tools we have added to improve the clinician workflow. On our pages, we have chatbot functionality to act as in-app support. For example, I'm going to ask the chatbot, how do I use the app? And the chatbot provides a response using the context of which page the user is on, as well as what they have prompted. On module selection, users are able to select which patient they would like to view. We want to keep all patient data available for all users in case of medical emergencies. However, we want to ensure that this data is being viewed ethically. To achieve this, any unauthorized actions are recorded into an audit log for administrative review later on. For now, I'm going to click continue.
Here we have our heart risk module. You can see the patient's data up top, along with our model's predicted probability that a patient develops atherosclerotic cardiovascular disease within the next 10 years. We have intuitive visualizations down below, showing the factors that contributed to the model's decision and how, so the clinician can see how our model came to its conclusion and what it sees as the most important pieces of the patient's data to the issue they're looking to treat. We also have generative AI summarizations of the patient notes written by the provider, as well as chatbot support for provider questions about the model's prediction, the patient, and their data. Here we trained an explainable boosting regressor on a data set we put together from public health surveys from the CDC to mimic standard EHR data, and the risk in the data for each patient was calculated by the same ASCVD risk formula cardiologists are currently using to predict this exact thing. And here we can see a clinical summary of the notes about this patient generated by our chatbot. Moving on to our hospital readmission page, you will see it's very similar in design to our heart risk page, with all the same tools for a different use case. For this module, we train an explainable boosting classifier on a published and well-studied data set to predict the probability that a patient is readmitted to a hospital within 30 days of initial discharge. We have all the visualizations and data presented just like the previous module, and here you can see a diagnostic suggestion from our chatbot based on this patient's data. Now, we'll transition to our drug dosage optimization page. For this module, we used another explainable boosting regressor to estimate the optimal dosage of a specific medication a patient has been prescribed. The dataset we used was based on weekly dosages of warfarin, a common blood thinner used to treat and prevent blood clots. But other datasets from healthcare systems could be plugged in with minimal modifications to the pipeline for the same effects. You can see the chatbot generating a patient-specific explanation here to support healthy communication between the provider and patient. Leaving our primary modules, I want to show you our model metrics page. We've focused a lot on transparency throughout development, and this is a big part of it. We know users could be skeptical of our models and their predictions, so we've included numbers and graphs to display their performance for people looking to validate our models and confirm their effectiveness. For our heart disease regressor, R-squared is used to represent the fraction of patient-to-patient differences in heart disease risk that our model was able to explain. Our model achieved an R-squared of about 0.96, almost perfectly mimicking the ASCVD risk formula, so the clinicians are saving time and can trust that the model pipeline is trustworthy and effective. For our hospital readmission classifier, AUC measures how effective our model is at differentiating between an at-risk patient and a low-risk patient for readmission. Our model hit an AUC of 0.67, consistent with the standard formulas like the LACE index calculated by clinicians for this exact purpose. It's also within range of tools and current software systems hitting around an AUC of 0.7. This is a notoriously difficult problem to predict with tools like this, but our model's performance is up there with the best of them currently available. For our drug dosage regressor, R-squared was used again to measure performance. Our model hit an R-squared of 0.47, which is around the performance of the published algorithms for this that hit about an R-squared of 0.43 on the same data. This is another incredibly hard problem for current machine learning models, but according to our dataset, this model is just about as robust and effective as the other systems out there. I want to be clear that these models are not made to replace the provider's judgment in any way, but they're there to supplement them in a simple, quantitative way. The goal is for the provider to view the predictions as a potential starting point when they're designing the treatment plan for their patient.
Another page we have added for transparency is our sandbox mode. While not traditionally found in healthcare workflows, we wanted a way for users to experiment with our three models. On this page, users are able to manually input variables and create predictions. For this example, I will run one of the presets and click Run. Once the prediction is returned, the user is able to see the model's prediction at the top of the screen, as well as a visualization showing how our model got to its decision. By letting users understand our model, this causes users to feel more confident in our tools, leading to more confident decisions. Another way we have improved the clinician workflow is by adding in-app note-taking. SOAP notes are an industry standard format, so we wanted to follow a structure that users would be familiar with. On our page, the user is able to create, view, and edit notes. For example, I will create a new note for Jared Scott. I'll go ahead and select the patient, and then for this module, we'll go ahead and select heart disease risk. And then for the sake of time, we'll go ahead and just paste some filler words. And from there, we'll now click Create. This will allow the user, as well as other employees, to view patient records. On View, once I select Jared Scott, I'm able to see the note we have just created, as well as edits if need be. These SOAP notes power our module's AI summarizations, allowing users to get the context they need at a glance. As mentioned previously, we want to have patient data accessible in case of emergencies. With our admin tools page, administrators are able to view flagged actions from users to ensure our system is being used ethically. The user is able to filter by latest logs on top of specific actions. This includes edits or changes to any medical records, as well as unauthorized patient access. And that concludes our product demo. The outcomes of implementing our system would lead to users having access to industry standard predictive tools. Our application is adaptable to healthcare systems, allowing for smooth integration into any healthcare data the organization may have. Finally, clinicians are able to have streamlined workflows through our visualizations and tools. That concludes our Capstone presentation. I would like to give a special thanks to Capgemini for their collaboration on this project. Professor Birchfield for acting as a resource throughout the whole process of development, as well as our lovely AI mentor, Jared Scott. This is Starflower Solutions, building simple solutions.